From NBC News, this is Today.
This morning, in conjunction with our partners at iVillage.com, we bring you No 5 to Stay Alive. 8 million women in the U.S. have osteoporosis, which leads to brittle bones and fractures. But we've got 5 tips that could help keep your bones healthy and strong for years to come. Dr. Nieca Goldberg is the medical director of New York University's Women's Health Program. Dr. Goldberg, good to see you again.
Good to see you.
So first of all, what is osteoporosis?
Osteoporosis is low bone density, and we need to keep our bone density up so we don't break our bones.
So who exactly is at risk for osteoporosis?
Well, it's very important for all women to know their risk. One is small-boned women, which means that they're thin, short, or narrow at the hips. Of course, most women don't think they're narrow at the hips, so they should check that one with their doctors. If your mom had osteoporosis, that increases your risk. If you're a smoker or don't exercise or have low calcium in your diet, that also puts you at risk.
And how do you know you're developing osteoporosis, or are there signs?
Well, there are signs pretty late in osteoporosis. You have bone fractures or you're slightly bent over. But
so by the time you realize it, it's in a sense too late.
But there is testing for osteoporosis. Women who are after menopause, since they're at the highest risk, can get a bone density test, or younger women with risk factors. But we really need to focus on preventing osteoporosis, and we do that with diet. You really need about 1,200 milligrams of calcium a day in your diet, and you can get that from low-fat dairy products like yogurt, milk, cottage cheese, tofu, and soy milk gives you 1/3 of your calcium load for the day. Sometimes you don't get enough calcium, so supplements are necessary, particularly if you don't have enough in your diet or you're over 60.
Which is better? Is it better to get the calcium naturally through what you eat as opposed to the supplements?
It's always better to try to see what you can do naturally, but calcium supplements are particularly important in women over 60 because they reduce fractures. And for women who don't really get enough of the calcium in their diet, they need supplements. Also, you need vitamin D in order to absorb that calcium.
So you need the vitamin D to help you get the calcium into the bones.
That's right. It's not just enough to take the calcium, you got to get it into the bones with vitamin D. Most of us don't spend enough time in the sun, which is 20 minutes without sunscreen. So you really should ask your doctor about vitamin D supplements.
So now they tell us we're supposed to put sunscreen on and then go out in the sun. So does the sunscreen block you from absorbing the vitamin D?
In fact, my husband, who's very good about staying out of the sun and using sunscreen, became vitamin D deficient.
Ah, okay.
I made the diagnosis.
That helps having a doctor in the family.
That's right.
Well, you mentioned your husband. What about men? Do men suffer from osteoporosis?
Yes, men do suffer from osteoporosis, although less so than women. So it's very important for men also to take in calcium and also to exercise. And it's very important that women do weight-bearing exercise as well as men. They can do it together. And that means standing on your feet. So that's walking, running, the salsa, tai chi.
The salsa.
The
I like
salsa.
That.
Or standing up and pumping some soup cans or even your company's quarterly report. It doesn't matter. It's all really important. For instance, swimming is great for your heart, but it's not weight-bearing, so it doesn't build bone.
So bicycling wouldn't be...
Bicycling is not the best for building bone. It's a little better than swimming.
You talk about bone density tests. What's involved in that?
Well, it's a radiologic test that you go in, especially after menopause, and if your bone density testing usually gets followed up every 2 years. It doesn't take very long. It just takes several minutes to get the test done.
And once you get the results, what should you be looking for as far as the bone density? What's good bone density?
Well, a score of 1 is good bone density, and scores of less than 1 either states that you have low bone density, and those that are even less than minus 1.5 say that you have osteoporosis.
You talk about the stuff that you can eat that has calcium. Are there foods or things that you can do that take the calcium out of your body?
Certain medications like prednisone, seizure medicines, and even some thyroid medicines can do that, so you really should check with your doctor.
In looking at this problem, how serious is it? Is there any one group, say African Americans or Hispanics or folks who are more prone to osteoporosis than others?
In particular, Asian and Caucasian women are more at risk for osteoporosis. So that I think that all women are at risk for it, and the best prevention of osteoporosis is diet and exercise, and I think on a daily basis it's really easy to take care of your bones because all you need to do is take a walk.
If you've developed it, are there medicines that you can take to kind of help reverse this?
There are lots of options for medication. In postmenopausal women, there's hormone therapy. Also, raloxifene is another medication that builds bones, and a class of medicines called bisphosphonates that are Fosamax, Actonil, or Boniva. Those also build and maintain bone.
All right, Dr. Nieca Goldberg, thank you so much. A lot of great advice. If you want more information, check out our website at todayshow.com.